Hello and welcome to our mental health platform. I am Muthoni and he is
Tasmo.
and today we are going to talk about a very interesting topic and an upcoming topic or something that is there, that is mental health and poverty. By the way, Tasmo,
Yes.
what's your understanding of poverty?
Poverty is a state of uh, financial challenges. I mean, this somewhere someone is financially challenged, emotionally, physically, or mentally challenged.
Can we say a state of lack? Lacking something.
A
It's
state
like
of lack
lacking,
in simple terms. A
yeah,
state of lack. Yeah,
lacking
exactly.
something.
Yeah.
More.
Yes.
Let's talk about how poverty impacts mental health. Can you say it has direct impact on mental health?
Yeah, it does,
Mm-hmm.
and it affects mental health in various ways.
Mm-hmm.
One of it being social isolation and stigma.
Yeah.
This one comes in the point that when you are financially challenged mostly, or when you lack money, you tend to feel that, to have that feeling of shame, and you want to isolate yourself from people who have the money. Now, stigma is a very bad thing. So that's one way how mental health poverty affects mental health. Another thing is lack of access to
Healthcare services.
healthcare services.
Yeah.
Yeah, someone might be okay. Let's say, for example, someone is challenged mentally, or someone is going through depression, but they are also at the same time financially challenged. Social, health, to access resources, especially in Kenya, you have to pay.
Yeah, true. So
Yeah.
true.
So when you are challenged financially, it means you cannot afford the services.
That is so true.
Yeah. So this one now
True.
means that maybe this person may end up even being mad, insane,
Yeah,
because
true.
they cannot get access to maybe medicine and a therapy at the same time.
Also, let me add on that.
Yeah.
Ni kama you see those poor people, they can't access quality services.
Yeah,
Juu
quality
unapatanga
services.
there are
Exactly.
those private hospitals yani zimetengenezwa for rich people, and then kuna those level somethings hospitals zenye sijasema ni za zenye watu husema ni za watu wenye hawayuko financially okay.
Yeah.
Yeah.
Also,
That's happening.
yeah, it is.
Every
It is
day.
happening, by the
Yeah.
way. And also, financial challenges may increase the risks of may bring about mental
Yeah.
health risks.
Yeah, so true.
This is whereby, because a person getting a low income tends to have more tends to be more depressed than a person with a higher income. And that is factual. It's something that is proven, because especially when you see in Africa, most of the people in Africa, the larger population, they are either middle class or struggling. So conditions like ADHD and MDD, which is a major depressive disorder, they are also linked to poverty and being mentally challenged.
Can we also add that and say that there are these substance use disorders
Yeah,
like
yeah,
okay, after umeanza kutumia drugs as a coping mechanism,
yeah.
you end up getting some mental health disorders that are associated with substance use.
Yeah, exactly.
Maybe schizophrenia inakwanga at a higher risk
Yeah,
the moment
schizophrenia,
umeanza
by the way.
kutumia drugs.
Yeah. And also, on mental health and poverty, we have physical health links. So by saying physical health links, I literally mean that physical health and mental health normally tend to link. I mean, they tend to work hand in hand. When you are not good physically, when you have physical challenges, maybe you have a physical disorder, it tends to also affect your your mental health.
True.
And by saying that physical health links, I literally mean that, for example, there are these people who are challenged physically. For example, those who can't see, those who can't hear. Maybe someone is experiencing a certain maybe skin disease that is very severe, and they cannot manage it by maybe getting access to some services that need also financial involvement. So it tends to also affect their mental health negatively.
Yeah, true.
Yeah. Early addressing poverty is therefore a critical step in promoting mental health and societal well-being. Yeah.
So guys, that's all for today on mental health and poverty. Make sure to stay tuned, make sure to subscribe, make sure to comment, make sure to add whatever we have forgotten. Yeah, and stay tuned for more interesting topics to come. Bye guys, we love you.